And then I did a teeny little rotation, like, which should not have been a problem. And I did not have the language for herniation at that time, but that was pretty much what I thought had happened because it wrecked me.
Welcome to Bed, Back, and Beyond, sharing positive stories of recovery from serious back or neck injury. Your host is CK, a fellow champion who draws on her own experience with herniated disc surgery. Join her as she talks with others who have overcome the physical and emotional trauma of a painful injury, and discover for yourself how you can find hope and encouragement in recovery.
Hi, Deborah. Thank you so much for joining me on this episode of Bed, Back, and Beyond. Before we dive into your injury, how about you tell us a little bit about yourself?
Hi, CK, and thanks for having me. I was an academic for decades. I retired in 2021. I worked in the field of children's literature. And now, since retirement, I'm doing a lot of home archival stuff like family films, working on the garden, which fell into sad disrepair, and doing a lot of kayaking, doing a lot of short day trips to see friends, see shows in cities. So I highly recommend retirement to anybody lucky enough to get there. It's been great.
So did you write any children's books?
I didn't write children's books. I wrote reviews of children's books. So I did a ton of writing. What happens a lot to people in those positions is that we develop really high standards, and we're not sure if we can meet our own standards. So we're happy to cheerlead the people who are really good at it and who write really important stuff.
And how long have you been kayaking?
I did some canoeing as a kid, and then the first summer when I retired, I started doing some kayaking rentals in the state parks around here, and I just really loved it. And then a couple of years ago, I bought a teeny little kayak that fits inside my Prius, so I don't even have to hoist it up to a roof rack. I just shove the thing in the car and off I go, and I really love that.
It's great. My husband and I, we just had our 20th wedding anniversary, and we went up to thank you, to Banff National Park.
Gorgeous.
We canoed on Moraine Lake. Oh, it was amazing. I did not want to get out of that canoe.
Yeah. And there's something, I mean, I'm not like a big whitewater person or anything, and I don't live in an area where that's really a thing anyway, but there is something about just the difference in sort of the texture of the world when you're out on water.
Why don't we jump into your back history? When did it become an issue for you?
Sure. In 2014, in January, which was a bad time to be out gardening in general, but I was. I got into a pitched battle with a rose bush that was stuck in a trellis and started having back pain within about 24 hours. And if I'd known then what I know now, and I'm sure a lot of us say this, the trajectory of that year would have been a little different. But I went through PT and I went through sports med, and I didn't get an MRI till about August, and I'd been in a considerable amount of pain throughout that year. And my job was always, it's an academic thing, so it's already weird, and we were almost literally under the radar. We're working in a basement, so I would like work lying on the floor, or we had a little sofa. I'd work on that, so I could do adaptations, but I mean, let's be real, it wasn't great. So I had an MRI in August, and from across the room, I saw the degree of the herniation and said, "Oh, yeah, that's not good." And at that point, I had previously had a cervical fusion in, I want to say 2005, about 10 years before that. So I had enough experience with waiting too long, which looking back, I did for this too, but whatever. And knew the instant that I saw, I'd already been waiting 8 months, dealing with a lot of pain. Things hadn't improved. I wanted surgery. I called around the next day because there wasn't really much in the way of surgical opportunities in the town that I lived at that point. The one person who did, I'm not even sure he did microdiscectomies, but he'd retired from surgery. He was just doing sort of surgical consults. So I called Chicago, which is the nearest big city, and called the two big spine centers at Rush and at Northwestern, and Northwestern wouldn't promise to get me in with someone who did microdiscectomies, and Rush did. So I went to Rush and went in for a consult probably got in August, and the surgeon said, "Yep, absolutely, you're a great candidate for microdiscectomy. Let's do it." I waited till November because I needed to time it since I was in a unit head. I needed to time it so I could take the time off. So I timed it for the week before Thanksgiving, had my surgery the week before Thanksgiving, had slower and more complicated recovery than I had hoped for. So I did a lot of working at home, was on FMLA, really went back to the office starting in January. And even then it was sort of short term, and I had like a temporary disabled tag, which was utterly pointless at work, but was helpful in some other places. So it took probably 6 months to a year before I was really able to say, oh, that had been a good thing to do. I was glad that I did it. And as we will get into, there have been subsequent developments where I've felt even better. So I think there's different kinds of improvement you can get post-surgery. There's straight up healing, but there's also just, improving your strength and your biomechanics, which can be as effective as healing in making you feel good and able to do stuff.
You're my first guest ever attacked by a rose bush, just so you know.
It's good to have kind of a unique selling point.
It is. It is. No more sparring with the bushes.
Doctors don't warn about that enough.
Yeah. So from January to November, between your initial injury and your surgery, what kind of things were you doing for your back during that time?
Oh, heating pads and whining. I had
with wine. I hope whining with wine.
Yeah, sadly no.
No, okay.
I had a cane for occasional use. Like there was a once in a lifetime sort of memorial reunion thing happening that summer up in Minnesota, and that was in a rural area, and I'm like, I need something that says I am a fragile thing. So I wandered around with the cane, and that was helpful. But yeah, I've always been a big heat person. And still I run to heating pads every now and then. Something is an ice thing, but um and probably a lot of ibuprofen, which I think you've been there, that there's only so much ibuprofen will get you when you're in serious distress, but you do these things sometimes as an article of faith as well as because they work.
Right.
Like, maybe, I don't know, maybe I shouldn't stop.
And did you say you tried physical therapy for a little bit?
Oh yeah, I did a fair bit of physical therapy. Again, I know so much more about physical therapy now than I did then. It was there is the standard, as we know, when you have an MRI that shows a herniation, insurance wants you to do 6 to 8 weeks of physical therapy. Some of that is just busy work. It's like, it's probably going to heal here, be occupied this. So the physical therapists, yeah, it really is. I mean, and I really support physical therapy. I love physical therapy, but I think it's good to be pragmatic about what its goals are at certain points when it's presented to you. So they focused on some standard things, like there's a lot of back extensions. In fact, I now know I'm extremely extension sensitive. I don't do back extension at all. So they kept running me, and I'm like, should it hurt this much? He's like, yeah, it'll hurt a little. No, it shouldn't have hurt that much. So it wasn't great physical therapy, but
but you checked that box and you got it done.
I checked that box, and it's probably not a bad thing. I don't know whether it sustained any of the gains long enough towards surgery anyway, but it's not a terrible thing to have some improved strength, like in the glutes and stuff. If you're going into surgery, that's not a bad thing anyway, because you're going to want that. So I did it. It did not fix me. A lot of people, most people get better in that time.
Yes, they usually say like 8 months your herniated disc.
Yeah.
So after 8 months, you're like, nope, I'm still in a lot of pain.
Yeah, enough is enough. And retrospectively, I'd say also, and this I think doesn't get factored in as much as I think it might. When people are talking about surgery, and a lot of the time here I'm talking about Reddit, which is where I'm talking to a lot of people who are suffering, and I like to hang out and go, I did it. It went well. I'm doing
Mhm.
well. Most people like that go away. I'm still here to go. Really, most people get better.
Yes.
But they weigh the risk of surgery, and there is a risk. Let's not lie. And one of the risks is it doesn't make you better.
Right.
But they don't weigh the risks of not doing surgery. They don't weigh the risks of keeping things the way they are.
Right.
So, for instance, I have a touch. I'm 62 now. I have a touch of osteoporosis in the left hip, which is the side where I had my herniation. I think the debility of not using it contributed a lot to that, and of course, it contributes to other biomechanical stuff, and, it messes with your brain. Pain brain is a hard thing to get over. So there's risks in not action as well as there's risks in action, and they both have to be weighed.
For me, it was a cost analysis of time. I was out of work without pay, and there was no way I could go back to work. I
Yeah,
was in so much pain. So it was either wait the 8 months to see if it starts to get better,
right.
or have the surgery and hopefully it gets
Yeah.
better quicker. And so it just made sense financially to get the surgery sooner.
I couldn't have hung on to my job for another year. I mean, as I
Mhm.
said, I mostly wrote. That's a really fine mental process that is much harder to do when your brain is struggling to deal with pain. Um, so I was lucky that it was a weird job that I could hang on to during those 8 months, and during the month or two when recovery was going weird. But um, yeah, I mean, I think that especially when you're talking a microdiscectomy and not fusion, so there's much less risk of sort of subsequent sequelae. Like, my cervical fusion is doing really well. I have a teeny bit of adjacent segment wear, very little. But people, I think, um, the sort of common feeling about back surgeries, I think, comes from old school fusions. And they're like, oh, yeah, if you have a back surgery, it's going to make you weaker for the rest of your life. It's really not.
Yeah, 100%.
And also they're like, if you have a microdiscectomy, you're likely to have a fusion. It's like, well, I don't think it's because of the microdiscectomy. I think it's because you've messed up your back, and that makes you
Exactly.
likelier to have a fusion.
Yes, right. The one of the biggest anxiety factors for me when I was deciding on surgery or not was the number of older people, older generation people coming to
Right.
me saying, "Whatever you do, don't let a doctor open up your back." All
Yeah.
experienced or stories from old fusions. Like, no, I
Right.
don't tell me that.
Yeah. Yeah. I mean, it really has changed so much.
Mhm,
Um, and it's still highly imperfect, and there's a lot going on that I think we'll get to about
mhm,
what is on a scan and what seems surgically plausible and whether that's going to bring you relief or not.
mhm,
But this is also why, again, I'm going to go back to Reddit discourse a lot, why um, I don't tell people whether or not to have surgery, but if
mhm,
they can't convince a surgeon to have surgery, I'm like, if a surgeon doesn't want to have surgery on you, you don't want to have surgery.
mhm.
They like to do surgery. That's what they live for. They don't think it's going to make you better. They have a really good idea of these things. So, I wouldn't assume they're wrong.
Now, do you happen to know the millimeters of your herniation?
Um, I don't remember. I went back and checked, and this goes a little bit to what I was just talking about
Mhm.
scans and stuff. I looked at my text reports of the MRI pre-surgery, and then I had another one in 2020 because I developed a lot of back pain in 2020. A lot of us had pain in 2020.
Yes.
And that got a lot better with really good PT, but the scan, the radiologist report is not hugely different, which is kind of interesting. But yeah, the I also had a laminectomy, and that I think was pretty significant because it was let's see, yes, moderate to severe central spinal canal stenosis.
Okay.
But I vividly remember the visual of the standard sagittal cut of the
Mhm.
MRI. And I literally, as I said, was sitting on the exam table across the room from the computer going, I can see that.
Yes. I don't know the millimeters measurement of mine. I can't
Yeah.
find my old report. But when I look at the picture, I think that little thing, like it looks like a little
Yeah.
thumb poking out compared to others where it comes all the way out or it's going
Oh,
down.
yeah. Yeah. The ones that are ascending or descending, I'm like,
Yes.
oh, that doesn't look good.
Yeah. And I was
Um,
like, what was I crying about? I was on the floor for 2 hours.
oh, yeah, absolutely. But think about it. What I compare it to is like dental work. It's like you get a nerve touched in dental work. Yeah, a drill isn't a big thing, but that hurts a lot. So it's think of it as dental work on your spinal nerves. So that's gonna hurt.
Now, when you made the decision on
Mhm.
which practice, was it just based on who could see me fastest?
It I went with U.S. News and World Report, and also it was going to be University of Chicago, Rush, or Northwestern, and
Okay.
Rush and Northwestern had higher rated spinal things.
Okay.
Northwestern just had the kind of recalcitrant scheduler who was. I said, "Look, I'm really interested in getting a microdiscectomy if that's possible. Can you schedule me with someone who could do those?" And she said, "We're not going to do that until we know if that's possible for you." I'm like, "Okay, but you have to schedule me with somebody." Um, and I was like, I'm not going to have this fight. And I called up Rush and they were like, sure, we'll schedule you with Frank Phillips. And I went to Frank Phillips, who's ends up being the big cheese there. And I don't know whether you've read much. Actually, no, I take it back. That's the wrong source. Never mind. But there's a Malcolm Gladwell thing about surgery, and he's basing it on umbilical hernia surgery. And I said, you want somebody who just does this over and over and over again every day. That's what you want. And that's part of why I wanted to go to Chicago and not they have like somebody coming in twice a week.
Mhm.
They're operating on a bunch of different things. I want somebody who's like, I have seen 76 spine herniations before breakfast today. So, if I was lucky, I have good insurance and have been fortunate enough that I can afford to pay for the slightly fancier one that lets me
Mhm.
go and choose in bigger cities. So it was just the first one who said, yes, we will go and have a look at you.
And was that orthopedic or neurosurgeon?
It's orthopedic.
I made my decision based on who could get me in soonest.
Yeah.
So, terrible way to make a decision, but you're in so much pain, you'll do anything.
Yeah, I think, if you weed out the bottom feeders, if you will, after that, I think for most of us, it's obviously super important to us, but I don't think it's that hard a surgery to do.
Right.
I think when you know what you're doing, this is fairly straightforward.
Sure.
Um, I I don't I don't think that neuro versus ortho matters a ton.
It doesn't
Um,
I don't think it does either.
Yeah, I mean, there's a little bit of research that suggests slightly better outcomes with neuro,
Mhm.
but I think that's also kind of the bottom feeders effect.
Mhm.
That when you get up to a certain level, it's probably pretty much the same.
Right. Right.
And it's also when you have a specialized spine surgeon,
Mhm.
they're not so much a neuro or an ortho, they're a spine surgeon. That's what they're
Exactly.
about.
Right. Yeah. And was your procedure same day or did you have to stay overnight?
It was same day. Um, it's 2.5 hours from where I live. So a friend and I went up the night before, and she drove me back that night after I came out of surgery, and they were like, "Nope, we can do that. That's no problem. We will." I think probably did some local anesthetic so that I was reasonably comfortable on the ride home. The one thing I hadn't factored in was that they'd pumped fluid in me in the meantime, so desperately needed to pee a couple times on the ride home. So I used to live on the south side of Chicago, so I remember there was a Walgreens. I'm like, can you get off? We need to go to the Walgreens. Okay, fine. And then closer to home, I was like, I don't think I'm gonna make it. Can we get off at this exit and see what we can find? And I'll just stand in a ditch if that's what I have to do. And we found a lovely porn store that was incredibly hospitable, very nice woman, just charming. And she's like, oh, sure, use the bathroom. Beautiful little ceramic bustier with dried flowers in the back of the toilet. And we're like, this is wonderful. If we ever need porn, we're coming back here.
Probably would have boosted your spirits while you were recovering.
It could be. I don't know. I wasn't feeling quite up to it, but
Right.
later on for later use.
Yeah.
So yeah, that was it was mostly negotiating the bathroom stops.
Mhm.
And I was very glad to be home. And well, there were a few times in recovery, standard protocol would have been a post-surgery exam, like within a month or something. And they said, you know what, you don't need to come up.
Yeah,
That's
drive
going to
2
be a
hours.
tough.
So you mentioned that your recovery was difficult. Can we talk about that a little
Sure.
bit? In what
Yeah.
way?
I had what I think is not uncommon, which is some delayed post-op inflammation. And my surgeon, and I think this is not uncommon, really likes to focus on the positive stories. He was also, and I was perfectly happy with him, but he was not a people person and very wisely left the handling the humans to like his physician assistant. And the first week went pretty well. And I was, mapping how far I was walking. And the second week, things kind of got worse. And I wasn't super happy about that, but, hanging in there. And then I did a teeny little rotation, which should not have been a problem. And I did not have the language for herniation at that time, but that was pretty much what I thought had happened because it wrecked me. And I spoke to the office and they're like, we think you just irritated a nerve. We're going to prescribe you some Lyrica and we're going to suggest you hang in there. But yeah, that was the famous Christmas where I was kind of butt scooting my way around the house and sort of lying on the floor and crying and watching Poirot. So a low point, if I'd known then what I know now, also about how it came out, I would have been mentally ready for it in a way that I wasn't.
Right.
And that's, again, people I see posting around it going, I had surgery 2 weeks ago and things are really starting to hurt. I'm like, I don't know what the surgeon told you. This actually happens.
Yes.
It doesn't mean it didn't work.
That's why I started the Reddit, because I got hit with the 2-week surge of pain. And then I think it was 5 to 6 weeks, another round of pain and weird symptoms and so many ups and downs.
The weird symptoms are wild. I genuinely thought I had developed tarsal tunnel syndrome at one point because I'm like, I hadn't had pain on the inside of my ankle bone. I was like, what the hell would that have to do with it?
Yeah.
Well,
pain on the opposite leg. I had pain on the opposite leg swelling. My butt was cramping. I had to drag my foot.
Yeah. And it is, now it's funny. We got through it. It turned out okay. But during that time, I mean, one of the things I remember specifically is that I asked my surgeon, I said, my bedroom's on the 2nd floor. Do I need to make arrangements? He said, never had anybody had a problem with stairs. So after 4 weeks, I went up on my 2 legs and not on my arms and feet anymore.
Yeah, it's emotionally traumatic.
Yeah.
The recovery for a lot of us, not for everyone, but
yeah, no, but
definitely was for me.
I think the flip side of the generation that's like, don't let the doctors in there with their knives is all the people are like, oh yeah, doctors especially love my colleague had that and he went and did more surgery that same day. They're all, I went dancing that night and I was like, well, that's not what's happening to me. Is this right?
My brother-in-law just last year, he had a microdiscectomy after waiting 20 years. Dealing with the pain for 20 years. He had the surgery on Friday. He was back to his job on Monday, and he's a painter. So like climbing ladders, paint. I said, how on earth are you doing this? And he said, well, pain has been my friend for the last 20 years. So it doesn't feel any different to me. Like I'm on my couch crying.
You do get different relationships with this pain. That's true. I find in some ways I'm actually less tolerant of it than I was because it was so stressful at that point. I have a better understanding of it and I can figure out better where it fits in the landscape. But I think I don't think I would have the ability now to go, no, I'll wait 8 months and work lying on the floor. I don't think I could do that.
So are you back to kayaking and things like that?
Oh, yeah.
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 And how
Honestly,
soon after surgery did it take you to start getting back into your normal living?
well, I didn't really start kayaking until 2021. So that was 7 years after surgery.
Mhm.
And um, my work was pretty intensely focused. So it took a lot of time. There's a lot of after hours reading and stuff like that. So I mean, which I guess my way of saying my normal life didn't involve doing a lot. So it didn't take a lot to get back to that. I think that people talk about the year as a useful marker. And yeah, I think I was pretty much doing most things by a year. The 2020 back pain, where I kind of had another MRI and they said, it's probably your facet joints. Go for a steroid shot, not an epidural, just a steroid shot. And it did nothing, and maybe made things slightly worse. And the injection doctor said, "Oh, well, that's probably because we did it in the wrong place. We should do it again." I'm like, "No, I don't think so." I said, "Look, seriously, there's got to be something else. Do you know, like a specialized PT?" And he said, "Okay, I know this one guy." Well, this one guy who I started seeing in 2020 has a sideline in personal training, and I've been with him for the last 5 years. So that is, it is an incredible stroke of good fortune that I know not everybody gets to have.
Mhm.
But I really thought I'd reherniated, and he was like, "No, you just have no butt. Here, I'll work with you."
Yeah.
And in like 4 weeks, I was like, "Oh yeah, that's fine. That's better now."
Yeah.
Um,
I don't think people realize how important the butt is for supporting the back. We all
oh,
think about our abdomen.
you gotta have a butt. You
Yeah.
gotta have a butt. You sit all day. That's not great for butts. And then the glute medius especially tends to get ignored a lot.
Mhm.
And mine is not very talented. So a lot of focus on that. Um, and also just the difference of having somebody to work with consistently is, I think this is what a lot of people really want from healthcare and can't get, is that
Mhm.
it's somebody who is familiar with my body and who, after experience, I now trust, but also can go, yeah, that's not right. I'm not doing that. Are you out of your mind? But also, I think a lot of us have experiences with different kinds of treatments in PT and going, okay, I put in a really good faith effort and that did not help and it
Mhm.
kind of sucked.
Mhm.
So you get less enthusiastic about trying other stuff. So finding somebody who's really knowledgeable and really curious and intelligent and thoughtful and to a certain extent a scholar. He's a fellow of the AAOMPT. We talk a lot about pain theory. We've done a lot of reading on that.
Okay. Mhm.
um, I'm an academic. I like that stuff.
Right.
um, that's made a big difference in overall how this gets mentally incorporated into my life.
Okay. Now, did you try physical therapy right after or were you prescribed it after your surgery? Was it part of the healing?
I was not.
Okay.
And I said, "Are you sure I'm not supposed to have physical therapy?" They're like, I guess you could." And I went and had some McKenzie therapy, which seemed useless. And I'm not making a comment about McKenzie therapy in generally, just for me, I was like, well, that's not making much of a difference. I don't know whether you've done any McKenzie, but that's basically sort of finding relief positions. And if you
Mhm.
keep going at the relief positions, that will help things. And he was always like, has it improved anything? I'm like, maybe half a point. I don't know. More targeted and perceptive focuses on strength and working. It's also important to work with that window. And I think this is a challenge with the sort of cookie cutter out of the box PT, is they're like, you will do 15 reps of this thing. Well, your body might only be able to tolerate 8. So it's like, if you'd done 8, you'd be fine, you'd be getting better, but you did 15. So now you're having a painful day and you don't want to do it again. That's really hard to negotiate, especially when you're not familiar with how this can go and you're coming out of surgery. So I'm not, I think people should have good PT after surgery. I don't know whether the PT I would have gotten working down here would have been really good PT. So
I swear by my physical therapist because
wonderful.
he was a big help emotionally for me.
Yes.
The number of times I was scared that I had re-herniated, went into physical therapy, and he was able to show me, this is your muscles reacting, and this is
Yeah.
because your muscle is weak.
Yeah.
And I could walk in and they would look at me and just say, okay, why don't we lay down and do some breaths first before we start? Because they would
Yeah.
see that I was having anxiety. So they were just so influential with getting me not afraid to move anymore. It's like, use your muscles. It's okay.
That is huge. And I
Yeah.
think, it's understandable. It's sort of like, I don't know, it's like if your first time using a gas stove, it blew up in your face. And you're like, there's weird flames on my gas stove. It's gonna blow up in my face again. And they're like, no, mostly they don't. Let me show you how to turn the knobs. And that's just, one of the phrases my PT is considering using in his business is pain coach, which I initially sort of resisted and then thought, no, actually, I like it as long as it's not the primary thing, because most people are like, but I don't want to have pain at all. But part of what he's been so useful on is that's the same thing you're talking about, is being able to say, yeah, it hurts, but it'll be okay. This is pain is not doom. Pain is something that can get better. You're going to do things, it'll settle down. Pain can be you had a bad morning, not, oh my God, I'm losing a year of my life and it'll never be the same.
Now, how long did it take you to feel better after your surgery? Physically.
Yeah. Better's a tricky term, isn't it?
Mm-hmm. Normal, maybe.
Well, I'm not sure I ever felt that. Let's call it 6 months.
Mm-hmm.
I think it was probably because 3 months is when I was still kind of sore walking from long parking spots and stuff like that and feeling
Mhm.
weird stuff.
Mhm.
So November to December to January, February, April, May, June. Yeah, 6 months is a good call, I think.
Yes, that's what I will say for mine. It was
Yeah.
the 6-month mark when I looked at my boss and I said, "Hey, I think I'm actually feeling normal."
Yeah.
Yes. Took me a year emotionally to recover.
Oh, yeah, easily. Yeah.
Yes. That's great. So do you mind if we just touch on your neck fusion a little bit?
Sure.
You mentioned that you had learned not to wait. So was neck
Right.
pain something you just dealt with for a long time?
Yeah, I mean, none of this is like your brother-in-law's 20-year thing. I do
Mhm.
not have that level of patience. Um, but it was closer to a year. I was trying to remember what the duration was, and I don't. Um, and it was a little bit similar in that it was the people I was initially seeing were kind of wrong footing me, and that it's like,
Mm.
well, you'd have to have this dangerous surgery, and you'd have to have this other thing, and then when you can, if you're in a smaller town, get out of town and go to a big city.
Mhm.
I went in this case, I went to Barnes in St. Louis, which is a fabulous hospital and healthcare center. And the doctor there said, yeah, you got a herniation, you need a fusion. It's not a big deal. And I went, oh, okay. And they had a fellow who just graduated from that program who's now practicing in my town. So I was able to do
Mhm.
that in town. And that was a breeze, that surgery.
Mm.
I had a 2-level fusion. I stayed overnight. I don't know if there even be overnight these days. Um, they didn't do like the full neck brace, which still occasionally some do. They just said,
Mhm.
here, have a soft collar. And then a couple days later, I went, I have a really short neck. The collar hurts. He said, well, then take it off. It's just to make it feel better. Okay. Um,
Now, did you panic when you heard fusion, or was your doctor great at explaining the procedure to you?
Uh,
Calming you down?
mixture of I didn't panic because I just wanted it over with,
Mhm.
and
Mhm.
also he did a good job of saying, "Look, you." He was a good surgeon for an academic. He was nerdy. He liked getting into the technical stuff. It was fun. He said, "Yeah, you will lose some range of motion at these levels. Probably you have lost more range of motion from pain already. So you are not likely to notice a loss. And that was absolutely true. The only time for years that I could tell that anything had happened was when I was backing up in a car and turning to look over my shoulder, and I couldn't get quite the rotation that I used to. And interestingly, when I started doing a lot of work on thoracic mobility, which I super recommend for everybody, because that's just so good for spine to keep that part mobile. It takes the stress off our poor lumbar and cervical regions. Then I could pretty much turn back around, and now I have a backup camera, so it's a moot point.
Right.
So that I think some of that was just being younger, but also in general, I think necks are just easier. They're so much less mobile than lumbar spines. I'd go on the fusion sub and talk to people who are looking at cervical fusions and go, mine was really easy. My lumbar microdiscectomy we'll talk about, but this fusion was really easy.
The fusion was easier than the microdiscectomy.
Yeah.
Yeah.
And I think that's really just a case of cervical versus lumbar.
Yes. Okay.
I mean, lumbar fusions seem like not fun. I don't want one.
Right.
But if I knew now, and I don't even know how much of an option it was, I would probably see if I could get an artificial disc replacement, at least at one level. As far as activity warnings, I mean, it is one of those things that is kind of it's up to you. It's not like the neck police are going to come and get you. But the surgeon said, so if you're a professional football player, if you were already making a ton of money and had a 2-level fusion, you'd keep playing. You shouldn't take up football. But if you were a professional football player and had to have a 3-level fusion, your career would be over. So I found that useful as a way of illustrating what the kind of risk and reward balance is.
Yeah.
So like, I want to try one of those flow riders. The water parks have them. They're kind of little fake surfing things where they have water going up a hill.
Yes.
And my PT was like, I think that's fine. Don't try standing up on one.
Yes.
That's where, if you bonk your head, your neck is not good. So yeah, you don't have room to spare in that. I'm like, all right, that's fair. I don't think I probably would anyway, but
I have talked to 2 people on the podcast who have had the lumbar fusions, and both of them say they wish they had gotten it sooner, that they had waited too long because of the fear of fusion.
Right.
And since then they're feeling great.
I hear that with knee replacements, which
Yes.
Obviously I'm of an age where I have a lot of friends who are doing this, and I think people are less scared of knee replacements as a surgery. But even then, I think the recovery can often be tough, but that doesn't mean it's not better than things were before. Which, I mean, I feel very much that about my microdiscectomy as well. It's somebody with a tough recovery, and I think it sounds like you're feeling the same way. It's like, that wasn't fun. Still glad I did it.
Right. Yes. If I could go back in time, if I had to choose again, I would definitely have the surgery again. I would just tell myself all the secrets for this is what you're going to experience during recovery.
Right. Yeah. That it might suck for a while. You don't have to just listen to the people who are saying that you will be cured instantly and be a Disney character waltzing through the hospital.
Yes. So do you have any remaining sciatica pain or flares?
I do have some residual sciatica pain to sensitivity. I have stayed on Lyrica. I've gone off it voluntarily, and the decision to go back on it, I tolerate it really well. I don't have side effects. It's all fine. And it's not a super high dose, but and this is something I talked to my trainer about, is that I can tolerate a lot more working out and physical activity if I'm on the Lyrica. And for me, the goal is what is up and around, what is up and doing, what is doing things that are contributing to my health. So the Lyrica wins in that. The other thing is, so I don't know whether you've run into the theory of central sensitization at all. That's Greg Lehman, Lehman, is a good person to look at. He has an interesting pain recovery workbook, but that's talking about, and again, I see some people on Reddit, and I'm like, I think I see a little bit of me there. That the way I tend to think of it is like, if your alarm system went off in a really big fire once, it gets kind of hair trigger. The alarm
Right.
system goes off pretty readily.
Mm-hmm.
And that's the central sensitization theory, is essentially that your system is now a little hyperreactive.
Mm-hmm.
And that's, I think that's a useful way also of framing it. I mean, I could go on for hours about and this is a problem with healthcare professionals and not just patients, but with the sort of core misunderstanding that either we see something on our scan or we're lying. It's like, no, somebody posted something last night saying pain is real. And what they were talking about was a friend of theirs who turned out, after people had missed it, to have a tumor on their spine. I'm like, valid, utterly valid, but pain is always real. There's no fake pain.
Right.
It doesn't make a difference what your scan is. Your pain is real. Now, mine might come a little more readily. And that's where the Lyrica kicks in, is that it's like, all right, that maybe dials me back to kind of a normal response level. And that's absolutely fair by me. And also, I think being able to move is itself something that helps with that. I think inactivity is so hard on the nervous system, so hard on the body.
Right.
So stuff that gets you up and moving is so good for you. Sometimes I just think of us as, like if you had a dog, it's like it needs to go out for walks, it needs to eat, and it needs to poop.
Yes.
And are you managing those?
Yeah.
And if you're not managing the going out for walks, what can you do to do that? Because that's really important.
I was saying it was like I had PTSD for the year after, because anytime I would get a sharp pain, triggered, like you said, and I would think I'm about to reherniate. And
I don't think it's like PTSD. I think it is a form of PTSD. It's probably milder than if you were in a war.
Sure.
But it's a traumatic response.
Right.
And the other thing that happens, and I think probably you were experiencing this too, and may still occasionally, is that we listen. It's like if you're a parent and you have a baby, you listen for the baby cry. And so you miss ordinarily, and there are noises in your house you wouldn't have looked for, but it's like, I felt something weird in my leg. Is this an important thing weird in my leg?
Yes.
10 years ago, I wouldn't even have, it wouldn't have risen to the conscious level of noticing.
Right. Yep.
So you part of the post-surgical mental coaching journey is figuring out the signal and the noise. It's going, yeah, it was really loud signal before. We're back to noise. Think of it as noise.
Right.
Yes, your body made a noise. Move on. You don't have to stop the world for that.
Right. Yes. My surgery was 2019.
Okay.
And so I'll get my numbness never went away. But I only really notice that when I'm shaving my legs. I can feel the difference between the two. And then I'll get a flare every once in a while. And it's usually around work if I had a tough day at work. And at this point, I'm just like, I'll just use my heating pad.
Yeah.
And I just move on. And I don't think people, people who are in it right now can never see them getting to that point. But you do. You learn to.
I also think that people who are in it can sometimes think that anything short of I will never feel anything negative again is taking a big L. And nobody gets that in their life. I especially feel for the younger people who are, like 20 something. And this is the first big thing to happen to them physically that isn't going to be better in a couple weeks.
Right.
And that's two lessons. You're learning about this specific injury, and you're also developing a different understanding of bodily frailty and what health and what wellness means, and that it doesn't mean nothing ever being wrong. And I'm not going, I'm 90, I'm going to have aches and pains. It's like, no, it's just, you're always going to have like that label in your clothes that's poking at you, and this other thing, and this hair pulls.
Right.
And the back stuff is part of that. It's just, it's all, as long as it's contained within I can still live my life. And I don't think either of us are talking about being, brave little soldiers and biting our lips and trying not to think about our agony. We're just saying, well, that was an annoying morning, and now things are kind of okay. And yeah, God bless the heating pad.
So you've had so many nice lessons in here. Make sure you have a nice butt. Learn about pain.
Yep.
Anything else you would love to say to people who are recovering or about to get a microdiscectomy?
I'm trying to think of if I can encapsulate this, because I think it can be a really isolating experience.
Mm-hmm.
And I think that's part of why it gets scary.
Mm-hmm.
I think forums can be tricky because advice is all over the map, and some people are self-interested in selling you shit, and some people are um, uh, just kind of wandering through. And there was someone last week who's go, "You have a terrible herniation." I'm like, that's their vertebrae, son.
Yeah.
So you get stuff like that, but that I don't know. It feels alone, but you're not alone. And one of the things that I sometimes think can be useful to think about, to get out of my own head, is that you do sometimes have people saying, "No one in my family understands this," and that definitely happens. But I also think there's the I think it's called the illusion of asymmetric knowledge, is that we don't understand other people's pain either.
Right.
We may think we do.
Yes.
I mean, they're not thinking a lot, because we're in pain, we're in our head. So we're all in our own heads.
Right. Mm-hmm.
So, there are other people going through this.
Mm-hmm.
This is a common experience,
Mm-hmm.
even though it feels maybe like you're totally on your own, because your bodily pain kind of cuts you off from people.
Mm-hmm.
So you are not as alone as you feel, I guess. That I didn't think that was where I was going, but maybe that's where I'll land.
Deborah, it was an absolute pleasure having you on the show. I really enjoyed speaking to you, and I'm so glad to hear that you've had a great recovery since 2014. It's a long-term success story that people are always looking for. So I think they'll really enjoy hearing your story.
Well, thank you for having me. It was great to talk to you.
Thank you. If you are a listener and you have a positive story of recovery that you would like to share, head to bedbackbeyond.com and click share your story. I would love to include your voice on the show. Once again, Deborah, thank you so much.